a month. And I think this year, more than anything, with COVID and with everything that's happened this year, it's really important for people to check in on their friends and family and also on their own mental health as well. So we've got Dr Andrew Rochford on the phone. Good afternoon, Dr Andrew.
Good afternoon. How are you guys going?
We are good, mate. Now, this is great that, we have this month so that we can make it people more aware to go and check on their friends, their family, their own mental health. Can you talk us through that process? If someone goes to the doctor and wants to get a mental health plan, what does that actually look like?
Well, I guess that first thing is it's a difficult step that I think a lot of people find hard, is to just admit the fact that, hey, I need help. I'm struggling a bit. I need to go and, see my doctor in the same way that I need to go see my doctor if I've got a high blood pressure or I sprained my ankle. And I think that's the first step for everybody, is realising it's all the same. There are people, there's professionals that can help, and you can get the help you need. So going to your doctor, being honest about how you're feeling and that you're struggling and that you want to feel better. And then there is the mental health plans that they can get you referred to. So a mental health plan, it's really just a fancy term for being able to get appointments with clinical psychologists and getting the treatment and the management that you might need covered by Medicare. So it means there's no out-of-pocket costs. It means it's covered by the government. And they've increased that this year because, as you rightly pointed out, 2020 has been a bit of a stinker of a year. And so the good thing is that, there's extra funding there for this mental health. So you can now get 20 appointments as opposed to, it was 10 in the past. And it's really important to get that long-term care that you need.
I actually went and got a mental health plan about a month and a half ago.
Right.
Because I didn't think I was doing that well. And I was like, and you are right, Dr. Andrew, but I feel like I have to call you Dr. Andrew. Can I just call you Andrew?
You can call me whatever you like.
I found that it was the hardest part was booking the appointment.
Sure.
Because it was like you said, it's admitting that there's something wrong. But when you actually think about it, and that was so perfect the way you said that, if you've got a sprained ankle, you go and get it fixed.
Yes.
If you've got a broken finger, you go and get it fixed.
Yep.
If you're not feeling good, you need to go and get that fixed. And I think the more we talk about this and the more that we discuss it and the more that we actually make people understand that there is nothing wrong with this.
It's normal.
It's a normal situation. Then I think that's so important. Now, the only thing is, of course, I went and got it, but I haven't actually done anything about it, which is just sort of life getting in the way. But it is something that I think a lot of people could really benefit from.
Yeah, absolutely. And a couple of really great points there. One, for me, what I'd really like to see is we stop thinking about admitting that we're struggling with mental health as being seen as a weakness and actually being seen as a strength.
Yes.
It's actually extremely hard, and it takes a lot of strength to say, I need help with my mental health. And I really would like to see us just being in that place where we're, in fact, in awe of people that actually have the courage to be able to do that.
Yeah.
And I think that the next step is, so how do you convert? How do you start getting that treatment that you need? And it's the same with everything. You go to the doctor and they give you, a course of antibiotics. You take the first couple of days, and all of a sudden you're like, I feel better. I'm going to stop taking it.
Yeah.
Sure.
And mental health is a little bit the same. You have to, you've done the first step. You've gone and got the mental health plan. Now, how do I get myself connected with a clinical psychologist? Somebody that matches what I need, might be able to provide that care and that management that I need. And yes, you can go in the real world, let's say, face to face. But something else that you can do is you can do it using digital health, and you can do that via the internet. You can do it through teleconsultation. We're seeing a lot more of it nowadays, purely because of restrictions and lockdowns and things that prevent us from doing so much face to face. There's been a huge upswing in the number of people that are using that telehealth consultation. And for mental health, it's almost the perfect scenario for healthcare. You get to stay at home. You can be in your pajamas. You can be comfortable and happy. You can connect with a professional, a clinical psychologist. You can use your mental health plan, and you can start getting the help you need.
Dr. Andrew, is there any tips on helping families talk about mental health inside their own family? Look, I grew up in a family where we never spoke about mental health ever.
Never.
It was almost, if you were feeling a bit down or there was almost something wrong with you you needed to just snap out of it. Do you have any tips on if families struggle talking about mental health, on how to kind of get the conversation going?
Yeah, it's really, it's hard. It's not an easy conversation, especially if there's a little bit of a generational gap there when it comes to kind of how things were dealt with in the past versus how things are, being dealt with now, and that the stigma around mental health is still something we're sort of fighting against. I think that being open and being honest, I think communicating is extremely important, but it's not easy. Lots of great resources online. Beyond Blue, Black Dog, They're websites that have great resources that give you, those tools that you need to start those conversations. The Digital Health Agency and also the My Health Record, there's a mental health toolkit on there that can give you some of those, so those simple tips that can help you sort of break the ice and have those conversations. The one thing that I would say is, and I encourage people to, is never second guess the thought of talking about mental health.
Yeah.
If you have thought about it, if you think you're worried about someone,
sure,
or you need to ask for help, that thought being in your head is all you need. Mm-hmm. There is nothing else. You have to, at that point, reach out and ask if that person is doing okay, because there's a reason why you've thought that. You're obviously probably worried about that person, or you're worried about yourself. And I think we just need to start being willing to trust our gut and start talking more about being mentally healthy in the same way we're so good at talking about being physically healthy.
100%. It is Mental Health Month all the way through till the end of October. Thank you so much, Dr. Andrew. I really appreciate that, and all those tips were fantastic as well.
My absolute pleasure. Have a great day.
You too.
See you guys.
That's 102.92.
See you guys.
That's 102.92.
See you guys.
That's 102.92.
See you guys.
That's 102.92.